My name is Professor Mike Dixon. I work in the Edinburgh Breast Unit and I'm a Professor of Surgery at Edinburgh University. We used wires for many years and then we went on to use mag seeds. And the issues we had with mag seeds is that they weren't being secured in the tissues and we were aspirating them up our smoke evacuator and we were losing a lot of them. So for us, they weren't ideal, so we were looking for something better, and that's why we moved to Scout. And the advantages that we saw with Scout is that they're better fixed into the tissues. And that was the main reason we actually switched. One of the problems actually currently is that patients have a core biopsy and then later on they have to come back for a second procedure. In patients where you are really quite sure that they have a cancer in their breast, there's a great advantage to doing the core biopsy and placing the Scout at the same time. It's much better and kinder for the patient. And of course, you've then got the Scout in the right place before surgery, and the pathway is much smoother. Yeah, from the patients, they love it because it's one less procedure. And I remember a long time ago, a doctor who said to me, well, it's only another procedure. It's not really that troublesome. And I thought, that doctor's never really spoken to patients. They like the least number of procedures possible with the least pain. So whatever's kindest to the patients is what we should try and deliver. The problem in the United Kingdom is there's a limited number of radiologists, and so there's limitations in radiology time, and it was much more cost effective to do everything at one go. And so our patients, when it's mainly screen detected breast cancers, when they're identified to have a cancer, a lesion which is almost certainly a cancer, they can have their biopsy and their Scout placed, and that means the next time they need to come to hospital is for their operation. And that saves a lot of money. Undoubtedly, the Scout technology is much easier for the nurses. One of the main proponents of Scout in our hospital are the theatre nurses. A lot of the other technologies you have to re-zero, mess around with. This is just plug and play. It's really straightforward technology, which doesn't break down. And I think that's one of the biggest advantages of the Scout system. We do a lot of breast conserving surgery procedures in Edinburgh. So we need a lot of branching of lesions in the breast to get them out. And previously we used wires. We have used Scouts, but I think with the introduction of the new system where you've got different Scouts that you can detect and know which Scout it is that you're chasing, I think that will have huge advantages in a centre like ours where we do a huge number of breast conserving procedures, and we frequently put in 3, 4, and occasionally 5 markers to bracket an area to make sure we get it out, because from the patient's perspective, if you're going to do a big operation and reshape the breast, it'd be great to do it once.